Remove the release paper and adhesive tape. Center the drape over the abdomen. Unfold the drape towards you and away from you. Unfold the drape towards the head. Unfold the rest of the drape towards the patient's feet. Unfold the pouch. Make sure that the adhesive film is properly attached to the patient. Smooth the adhesive film using a towel. The pouch is used to collect blood and fluids. The collection pouch is provided with drainage ports to drain the collected fluids before discarding the used drape. Draping complete.
With a cesarean section, there are 7 layers that need to be gone through for the operation. That's called a lower uterine segment cesarean section. The 7 layers include the following, and this can give you a bit of a visualization. The skin is the first. Could you have your little zipper here first? And then after the skin is the fat layer. The fat layer can look sometimes white or even yellowish. Through the fat layer, you then have the fascia, and this often does look white. It's stretched out and thin. Through there, we then get to the muscle layer, and the muscle layer is not cut but separated in that direction. We then get to the perineum, again in the vertical. You then reach the uterus, and obviously inside the uterus is where the baby is. The bladder, in front but lower, needs to be pushed out of the way slightly, and then the incision made to the lower uterine section. Once through the lower uterine section, you'll then identify the bag of waters, and the baby can often be seen through those. The bag of waters are small incisions made, and you may even hear some of the suctioning of the fluid being taken up by the suction, so that then can be made way for the baby. And through the bag of waters, the baby is then identified. In a cesarean section, the incision, as you can see from the start, is very commonly only approximately 10 centimetres wide. And so, once you get to the baby, if the baby is head down, the incision that is made, sometimes we need to use the forceps to be able to assist the birth of the baby's head through the incision. They're then removed and the obstetrician delivers.